What's the Buzz with Roseann Rogers.
A mother's hand is supposed to heal and comfort, but for the two moms you're about to meet, doing simple things like setting the table became impossible. That's when they turned to the Hand Center for help. As a single mom at the time, Judy Wooten needed to work in order to take care of her son.
I type for a living and I couldn't keep my hands on the keys. I couldn't pick up items. I was having trouble buttoning or zipping.
Judy realized just how important her hands were and decided to go to the Hand Center, which was founded by Dr. Michael Brown in 1991.
Well, I started off with my right hand because it was worse, and we did the endoscopic procedure, the Brown procedure, on my right hand. I came back a week later and we did the same procedure on my left hand in addition to trigger finger on both of these fingers.
Dr. Lopez is one of the many physicians at the Hand Center and treated Judy.
The Brown procedure is an endoscopic carpal tunnel procedure that's very different from the others. And what most people need to know is that its safety record is matched by no one else.
That procedure has turned into results not only for Judy, but for the more than 14,000 patients who've come to the Hand Center.
Typically what I tell people is that they'll be in a splint or a dressing for about 1 week, and then they're able to come out of the splint. People are most often surprised that there are no stitches involved with either the endoscopic carpal tunnel surgery that we do, the Brown procedure, or the Brown endoscopic trigger release.
Immediately after the anesthetic wore off on my left hand, I had immediate feeling back in my hand. It took my right hand a few weeks, but it came back, and it was so amazing when it came back.
Ironically, shortly after Judy got married, her mother-in-law told her about hand problems she had had for years but had gotten extremely worse.
She's a little bit older and requires a little bit different management techniques.
She's back to doing the gardening and the things that she loves to do.
Patients, including the Wootens, travel from around the state and around the world to see the experts in carpal tunnel syndrome at the Hand Center.
Our results are excellent, but I think we go a long way to making sure that the total patient is taken care of.
Although Judy and her mother-in-law's hands are fully functional now, they won't be using their hands in the kitchen this Mother's Day.
Probably going out to dinner and...
You're not cooking?
No, no, not cooking.